Hello, everyone, and welcome to today's webinar, Prioritizing Equity in Public Engagement in Data Research. My name is Anwar Gariban. I'm a member of the Public Advisory Group for the Public Engagement in Data Research Initiative, otherwise known as PEDRI. I am delighted to be here with all of you as we explore how data can shape a more equitable world. Before I introduce our esteemed speaker, I would like to take a moment to introduce myself. As I said, my name is Anwar, and I'm a public partner for PEDRI. PEDRI is a collaboration initiative that brings together various organizations working with data to drive meaningful change. I'm also an active member of the Patients and Public Involvement at the British Heart Foundation Data Science Centre, where I focus on the use of data in cardiovascular research. I am committed to inclusive and equitable research that brings in diverse public perspective. While my primary focus is health research, the influence of data extends far beyond healthcare. It shapes decisions in education, business, and policy making, and many other areas. Data can reveal differences such as variation in pay, hiring practices, and the allocations of healthcare and other resources. It can also highlight voices that are less frequently heard. Data is a powerful tool for fairness, transparency, and driving a more equitable society. Which brings us to today's discussion. I'm honored to introduce our speaker, Julian Harrison, from the Center for Ethnic Health Research. Julian has extensive experience in equity, diversity, and inclusion. Julian will be introducing the Center's Equity Impact Assessment Toolkit and how data research and the public engagement professional can use it to ensure inclusion is integrated in public engagement in data research. So without further ado, please join me in welcoming Julian. Julian.
Thank you. Let me get things up. Can everybody see my screen? Yeah, that's a good sign. Right, okay. Oops, slides not moving. Wait a second, folks. There we go. Right, got there in the end. Apologies for that, but yes, it's a very lovely thing for me to be with you today. My name's Julian Harrison. I am a freelance equality and diversity consultant, but one of my clients is the Centre for Ethnic Health Research, for whom I've developed the Equality Impact Assessment Toolkit. I think it might be just worth saying just a few things just to introduce myself as well. I've worked in equality and diversity for many years, more years than I can care to remember. I've not always done that. I used to work in professional sport. I was a rugby league development officer, can you believe, in a former life. And some of the stuff I also do now focuses on exactly the subject of this, public patient and public involvement. I use my lived experience of mental illness, lifetime of mental illness, and also I'm also autistic, to hopefully give that perspective for a whole range of other people as well. So I hope you'll forgive me for being autistic and having anxiety disorder. Is not always conducive to giving presentations in front of 100 people. So hopefully you'll bear with me if I do feel a little bit anxious, shall we say. But here we go. And the purpose of today really is a couple of things. Firstly, to explain what an equality impact assessment is. It might be a phrase that you're not familiar with. Lots of people will be, but we can't always assume that everyone will know what that is. Then I'll just tell you a little bit about what we've done at the Centre for Ethnic Health Research as part of ARC East Midlands in terms of equality impact assessments. And finally, I guess the big thing really, which I'm going to leave you with, is to encourage you, or to say, you know, how can you do something similar to us, or something completely different to us, but still use equality impact as a measure of inclusion and accessibility. So that's our plan for today, if you like. So, what is an equality impact assessment? Well, in research, it's a process that involves both analysis and practical implementation that helps a project or piece of research to ensure that different people's needs will be and are being met. It ensures that consideration is given to issues of fairness and of acting flexibly and differentially to ensure equal opportunity. It does pay legal and particular attention to the legal obligations outlined in the Equality Act 2010. And therefore, the idea is that an EqIA is an essential part of the process of planning whatever work it is you're doing. It prompts you to think more widely and more deeply. And this is a critical one. It's not simply the completion of a form. I'll talk a little bit about that in a bit. It is actually a live process that lasts the entire length of the research study. And this impact assessment needs to be undertaken by someone with a good understanding of the research. And I think it's worth just dwelling a little bit about the issue of it being a live process. It needs thought and construction at the very start of your research journey, and can therefore be quite a valuable addition to any grant funding submission. It's what funders are looking for increasingly, is evidence of what equality impact there might be from a particular bit of research or a project or whatever it is that you're happening to instigate. So allowing it to grow as an integral part of your research is important. And I think if you're not doing this as a solo project, I'll come back to that shortly, using your study team or group of people around you is quite important, in the same way that you involve a team in perhaps your overall research. Involving key people with different strengths and expertise is likely to yield profitable results when it comes to EqIA. So a researcher, PPIE representative, an expert, members of the public, more heads, different heads, etc., are better than one. That's the one I would suggest. Why do equality impact assessments? Well, there's a list of 6 reasons that I'm suggesting could be valid on the screen as it is. And all of these are important reasons for doing an equality impact assessment. So there's a mandatory case potentially for it. There's a research case. There's a moral and ethical case. There's a legal case. There's an organizational case. And there's a community case. And I think this is a real key thing with this. Collectively, they make a solid and thorough case for action. But if you treat an equality impact assessment as, if you see it as an administrative burden, something you just have to do to get the research grant through, etc., or it's a necessary tick box exercise, then that's all it will be. It's about mentality here. It won't go any further. So it's up to those involved to make it come to life, to make it matter, to make it integral to your overall research. And that is about attitude, it's about mentality, it's about recognizing the equality impact, but also the benefits to the research itself. So using that previous slide as a bit of a guide, completing an equality impact assessment form prior to beginning your project or research study may actually be a mandatory requirement of your organisation, or become one in the future. It is for ARC East Midlands projects that are funded through ARC East Midlands have to go through this process. I'm suggesting that ensuring fairness is the right thing to do, that a thorough EqIA should therefore ensure that the legal duties under the Equality Act and those enshrined under the public sector equality duty are both understood and are met. Equality impact assessments help an organisation not only to meet its legal duties, but to become more accountable, more inclusive, more credible, and more community orientated. Effective EqIAs ensure that community needs are thought of from the outset and are met throughout the process. And there are tangible benefits to researchers: funding, recruiting, publishing, and so on. A thorough EqIA is therefore more likely to ensure that your research makes a real difference on the ground. Here's the key question. If you decide to do something a particular way, who may be excluded? I'd like you to keep that in mind. Thinking of this and its many variations will help you concentrate on the need to be both fair and inclusive. So this is both your starting and your continual question. And it may actually be all you need to think about if your focus is small rather than putting in place a systemic system. If this is the case, just ensure that you ask this in relation to all the protected characteristics of the Equality Act and any further areas or dimensions of discrimination and disadvantage. So if you keep coming back to this fundamental question and its many varieties, you won't be doing far wrong. So how did Arc East Midlands develop and implement such a system? Well, here's a convenient little diagram with writing that's probably a little bit too small to read, but essentially our process is this. In every key question, in every key sort of protocol recruitment application, there will be questions on equality impact. So in any funding bid that you put through, for Arc East Midlands anyway, there are questions already there about what potentially your equality impact could be. Once the study has been approved by the scientific committee at Arc East Midlands, each team, each study team and a research contact gets our equality impact assessment toolkit to look through and to use as a practical guide. So the package is quite extensive, as I'll show you in a slide in a second. It's then up to the researcher and the study team to complete an initial EqIA, which is then considered and reviewed by our particular panel. And this is never a system of either rejecting it or approving it. It's about us providing a little bit of commentary on what's been said, some guidance about things that the research team might not have thought about, and also some constructive, hopefully some constructive additions as well in terms of content and things. That detailed feedback is given back to the team, and then it becomes a bit of a sort of to and fro process. We're there as a source of the EqIA panel, is there as a source of reference for people to come back to. And we provide that assistance on an ongoing basis if people do need it. And then, of course, there are the usual reporting mechanisms on a 6-monthly basis, yearly basis, and so on, which also have to include a consideration of equality action. So that's basically the system that we have. So what's in our toolkit? Well, there's quite a few things. Firstly, obviously, there's a form and a template action plan, which comprises of questions to answer in relation to the study. There's some guidance notes that accompany the form and the action plan to help guide people to answer it. We then include a whole slot really of different information, a directory of organisations, useful bits of information, some health inequalities data sample. That's grown to about a 100-page document now of things that people might use as part of your equality impact that focuses on health inequalities. We have a sample template, which is based around mental health. And we also now have a real-world example of an effective equality impact assessment, a form that someone has already completed and used to guide their actions as they go through their research. And the page looks a bit like this. As you say, it's on National Institute for Health Research, EqIA's Midlands page. There's all those things, all those questions are answered as a consequence of the page. Each of the documents, the headings or the front of the documents look a bit like this. I should also add that we have a separate EqIA form and action plan for systematic reviews as well, so that it's slightly different than the one that you see here. So there's a wealth of information there. So the question then becomes now, can you do something similar? Well, before you start, maybe it's worth noting that we've done a lot of the initial work for you, if you choose to use it, of course. So we have, as you've seen, a suggested structure. We have, as you've also seen, a proposed process. We have a toolkit of information for you to use. And the support mechanism for you to tap into, we do monthly drop-in sessions for anyone and everyone that has a question related to equality impact. It could be some research they're doing, it could be something they're starting, it could be a specific question about involving people from different communities. It could be absolutely anything. We do a monthly drop-in for 2 hours, and people come in and we get great conversations about all sorts of different things. If something else needs to happen, then obviously there's a support request process through EqIA's Midlands that might involve a little bit more time and detail, but we can support in that way as well if necessary. Some important principles. Your process, your equality impact assessment should be challenging, because equality itself is a challenging issue. It shouldn't, though, be overwhelming. And what we've done can be adapted, tailored to whatever you want it to be. It doesn't even have to be a system. It could just be a set of key messages based around that key fundamental question that I mentioned on the slide earlier. It therefore doesn't have to be as comprehensive and as detailed as ours. So we would urge people to be creative, to be flexible. One size doesn't fit all when it comes to equality impact. To be selective in terms of what might work for you and what potentially might not work for you. But remember the key question at all times. And we suggest that there are 8 potential steps. So first of all, decide on who's going to construct your process or decide upon your equality impact assessment. This could be someone with equality, diversity and inclusion experience. It could be a researcher, it could be a PPIE representative, an admin support. It could just be you alone if you're operating something personal or something quite small. Secondly, decide on who to approach for external support and advice. Now, obviously, there are lots of other people that you can choose to get advice from, but we're definitely there as a source of advice and guidance. As I mentioned, we have the interactive workshops, we have a support request system, as I mentioned as well, and then of course there's the tried and trusted approach of just sending us an email and getting an answer or having a quick 10-minute conversation. It's not a problem. Thirdly, decide on your structure if you're putting a structure in place. And this could potentially be, like us, having a panel of experts to look at each equality impact assessment and provide some feedback on it. So be aware potentially of the funding and resource implications for that, because there might be some. And of course, if you're including this as part of your funding bid, that might be something that you want to include as part of inclusive funding, inclusive costs. Fourthly, decide on your process, if applicable. When to do it. I would always suggest right at the start of your research, if possible as part of the funding application. But then think about the process of When do you give feedback? Do you give feedback? How much feedback do you give? What updates are required? Those sorts of things. It might be that you're not going to do any of those at all, and that's perfectly fine as well. But encouraging people, I think, to make equality impact a key and integral part of your whole research process and your whole inclusion process is vital, I would suggest. Fifthly, think about the material you will need. Potentially a form, potentially some guidance notes, all the stuff that's in our toolkit. Sixthly, devise your own form and guidance notes. And our material, it's there for you to use and adapt if you want to. Make sure your action plans emphasize the need to be smart, and also consider, like we did, do we do a different system for systematic reviews? So yes, devising your own form and guidance notes and any supporting documentation, or you're perfectly welcome to use ours either in its entirety or to tweak ours. That's absolutely fine as well. Seventhly, do a trial pilot and tweak when necessary. We did this and it just revealed just some minor tweaks in process, some expectations. Are we meeting the expectations of the researchers and the public PPIE representatives, and so on and so forth? So it's worth just doing something, having a bit of a dummy run, if you like. And then, of course, hopefully, on the basis of all that, you're good to go. So as we come towards the end, I just want you to sort of reflect really on the following 10 points. Firstly, in true Dad's Army, Corporal Jones, that dates me, don't panic. Lots of people do panic when it comes to equality because they think, oh, I've got to get it right. And yeah, it's important to get things right, but it's also important to learn the lessons for when you get it wrong. And we are continually getting things wrong. We hopefully learn from them and we develop things and we progress. That's the way it works. Take time to think things through. That's a key consideration. Ensure that you encompass all the protected characteristics of the Equality Act and extend them when and if necessary. So we have in our form not just questions on each one of the 9 protected characteristics, but we also have a section saying, are there other equality areas? Are there other communities who are discriminated against that might be inherent in your research? And encourage people to think outside the box, I guess. Remember that an EqIA is a process. It's not just the submission of an initial document that you never see again. We do get people that do that. And of course, that's perfectly fine to a certain extent. But, and I'll come on to this very shortly, we think people are missing out if they do that. Having a leadership, ownership, and a supportive structure for your EqIA process is vital. Like I've already mentioned, you can use the process and documents already in place in ARC East Midlands, either entirely or modified as you see fit. It's not a problem. Remember that doing an EqIA will make a difference. Your research will benefit as well as any tangible outcomes. Try and keep things simple. Overcomplicating things, over jargonizing things sometimes is a thing that we all do. So keep things simple, particularly if you're involving members of the public, as hopefully everybody is. People don't need to be shut out because of the formality and the complexity of language. Often they are, but they don't need to be. Review as and when necessary and make adjustments when you need to do so. Equality impact assessments are challenging, but they're entirely logical. Just want to conclude really by just outlining the difference, or some of the differences that we found in our ARC East Midlands process, which has been going now probably for 4 or 5 years, so it's well embedded. Firstly, researchers widening their equality focus and appreciation, considering issues in their approach that they'd not thought of before, recognising the importance of EqIAs in the grounding of research. An appreciation of the need for tailored approaches, that one size does not fit all. Early evidence we found of changes to trial design and to plan methods of recruitment and engagement through a better understanding of inequality, inclusion, as well as communities, and an appreciation of intersectionality. Recognizing that people are sometimes seldom heard, sometimes easy to ignore, but very rarely, in my experience, are they hard to reach. I can tell you plenty of other people who are hard to reach, but usually, from my experience, people in communities, we work right across Leicester and Leicestershire, right across the East Midlands, they're not them, but they are easy to ignore. A willingness, I think, to engage with our staff and those with knowledge of specific approaches and/or communities. So there's certainly an indication that people are sharing what they've learned with other people, with other researchers, with other PPIE representatives. Seeing and demonstrating that equality analysis is a process and that it will change either fundamentally or in more subtle ways as the study progresses. And we've also seen more effective use of available and varied data and of the importance of equality monitoring. We've certainly seen this, more focused consideration of issues of stigma, of issues of discrimination. Examples could be in relation to mental health, in terms of learning disabilities, in terms of sexual orientation, communities that are represented by all those, that growing list of initials. Epilepsy as well has come up as an issue. So focusing on these things has started to get people thinking, actually, this is interesting because different people come into these things in a different way. And involving communities is not necessarily, well, it never is, a one-way process, if you like. Recognition of the importance of accessibility and of the need for a flexible and varied approach to disseminating information into planning focus groups, workshops. Now, if, like me, you get frustrated when the culmination of some research is solely an academic paper or an 85-page report, which is hardly conducive to involving the great British public in that particular way of doing so, we focus a lot on dissemination of information. How are you going to ensure that everyone that you've involved in your research and in your project gets to hear the results, is actually part of the process of producing the results? So the formality of language, what sources of information, does everything have to be in the written word, etc., etc. All those things, people have dwelt a lot more on them, I think, as a result of the equality impact assessment process. Recognition of the relevance of other groups in addition to the 9 protected characteristics of the Equality Act. I think that's been a real big factor. People have gone into a lot of detail, sometimes looking at those 9 protected characteristics and dividing them up, dissecting them, if you like, and of course as well evolving intersectionality of combining them as well, which has really become evident in some recent research that we've looked at. Appreciation of the need to address, minimise negative or adverse impact, and the evidence of thought as to how to accomplish this. And we've seen as well evidence of some coordination between different study teams with respect to matters raised in their respective EqIA feedback. We've seen people, or we've heard of people comparing notes as to the feedback they've had from us, recognising where their particular research has been strong or where there's things that need to be added, and sharing it with other people has been a real positive lesson from all this. So what should an equality impact assessment do? Well, ostensibly it's this: help you to change mindsets, make a difference. So inculcating, promoting, developing an EDI mindset by the use of an equality lens. That's what the process is. Practicing equality impact until it becomes natural, instantaneous and constant. So it's like driving a car. It's like playing a musical instrument. It's like learning a language. The more you do it, the more you practice it, the more natural it seems to be, the more obvious it becomes as a process. And that's certainly our approach to it. Just to reiterate the importance of leadership and ownership, we are very lucky in our East Midlands. We have people that really want to lead on this, which is really, really encouraging. And again, just finally, just to reiterate, you need to continue asking the questions. If I do things in this particular way, who may be disadvantaged? And there we have it. There's some slide just to connect with us if we can. I'm sure this feedback will be given to you later on as well. So I'll stop sharing.
Thank you so much, Julian. That was a really fantastic presentation. And I just want to say that I don't think Dad's Army dates you at all. I think it's timeless.
Bless you.
Um, yeah, and it's lovely to see so many people here as well. Just to introduce myself, I'm Rachel, Public Engagement Officer at Research Data Scotland, and I will be chairing the question Q&A section. Just to give a bit of background about Research Data Scotland, we try to make it faster and simpler for researchers to access data, and we're also a PEDRI partner, so that's why I'm here as the chair for today's session. I can see there's lots of questions
That's
coming
really
in.
good. I'm looking at the chat as well. It looks really encouraging. Thank you.
There's so many questions coming in. It's absolutely fantastic. Just as a quick reminder, if you have any questions, pop them in the Q&A just because that helps us sort through the questions and keep track of them all. And also, if you see any questions in the Q&A that you like, give it an upvote, then we can kind of prioritize that. So the questions that have the most upvotes, we'll make sure we to prioritize. We won't, we might not be able to cover every single question. We will try to cover every single question. But if we can't, we'll still try and get back to you, whether that's through typing a message back or getting back to you after the meeting. But because we've got so much to get through, I'll jump straight to it. And the top voted question so far comes from Anna. So, how can data researchers use EqIAs to strengthen their funding applications? And EqIAs strengthen funding applications? And actually, that kind of ties in nicely with the question I had as well, which is, do you feel that EqIAs should be in all funding applications? Do you think that should be like a question that goes in there?
But the answer to the second one is absolutely. I do think it's important that funders do ask about, the potential equality impact, and I think the evidence that certainly I'm seeing and I'm hearing of people, not just in health research but in other areas of research which involve, funding applications, is that yes, if you put something in there about equality impact at the very outset, that's going to be a key dimension. It might not be the full, game changer in terms of whether your research gets the funding or whether it doesn't. But I would have thought that all areas of health research will be looking at the equality dimensions. We'll be looking at how to include people from seldom heard communities, etc., etc. So I do think yes, it should be part of funding applications. But I also think if you're not asked those questions in any funding applications, there's nothing to stop you drawing attention to the EqIA process, or to say simply that we are looking at equality impact. We think there's going to be these particular research, these particular equality connections, and the significance of these things might come up. So don't wait to be prompted by a formal question. Include it anyway, I think would be my strong suggestion.
Oh, thanks, Julian. Yeah, it certainly seems like something that could definitely strengthen applications across different research
You'd
fields.
think so. You'd think so,
Yeah.
wouldn't you, really? Yeah.
Um, Going back to the question list, there is another one up here, which I can say personally I've come across myself as well as a PPI professional. But what would your advice be for patient and public involvement professionals who have limited support, time, and resources to spend and respond to additional needs, but they want to be more flexible and inclusive? So,
Oof.
how do you cater to that? Obviously, it can take a lot of time to be inclusive.
Yeah, and I guess this might come back a little bit to the previous question. I think the issue of inclusive costings for research and needs to be thought of in terms of what how is it going to cost to do all these things, and I think one of the challenges as well, and I feel for PPIE representatives on this, is that often equality things are thrust upon the PPIE people, and as being like, it's your job, and that should never really be the case. And I think if you're involved in some work with others, uh, we used to have a great big mantle where I used to work, which was equality is everybody's business. And I think it's about making that a lived focus. So try not, you might feel very alone at times, and you might feel that these questions are coming your way. But maybe it's because I'm a blunt, cussed Yorkshireman. I will always deflect them if I feel they shouldn't be answered necessarily just by me, but they should be questions for other people to focus on as well. So I think, yeah, get people around you. I think sometimes as well, key people from communities, you'll know who they are in your area, within your particular area of health research. Getting people involved very, very early as well. Yes, there's got to be a costings implication for all that and so forth, as there should be. People should be recompensed for their time and their expertise that they're giving. Of course, they should. But yeah, if you get people on your side very, very, very early on, and ask other people for their thoughts, their opinions, almost deflect questions back if people are thinking that you're the sole answer to these questions. I will always say, well, what do you think on this? Who do you think we should be involved in? And that can be a really positive thing, because it gives the right indication that doing an equality impact assessment, if you're going to do it particularly on a systematic level, should never be a solo effort. It's got to involve lots and lots of people. That's the only way it's going to be successful on a systematic level. Yes, you can do research and you can look at PPIA and you can think, right, if I just keep that fundamental question in mind, that's going to guide me through. And yes, it will. And it will have an impact. But if you're putting something systematic in place, think about who are the key influencers and key people. I guess it's good co-production. There's a jargonized word for you, but yeah, make it real and make it applicable to more people. I think that's the key thing.
Yeah, and I think in your presentation as well, you mentioned that that people, even small organizations, should be able to complete this form. And I wonder if doing an EqIA might actually give you some of that impetus to try and maybe push for a bit more support in those areas.
Absolutely. And I do think if it's part and parcel of the sort of systematic approach to you doing it, it's a compulsion for action as well. Has to be.
Yeah, that's a really great point. I'll jump on because I'm aware we're running out of time. We've got so many questions. So we've got another one here. What would your advice be for people who want to use EqIA principles in their work but don't have an EqIA review panel in their organization?
Yeah.
Who do you think they could have it reviewed by? Potentially a colleague, or?
I would always say by somebody else. I think reviewing your own work is probably not going to work. But yeah, there's nothing like, even though we've put this in place, this process in the East Midlands that does have a panel that's resourced and it does have a structure and all the rest of it. That didn't happen overnight. That could be something that you potentially are working towards, and doing it very small to start with. Maybe just doing it on your own. Just asking that fundamental question, look at our guidance notes, look at our form. Can it work for you? Do you need to answer all the questions that we have in our form? Maybe not. But then involve somebody else, because it's that old process, that old mantle of two heads are better than one. Get someone else's thinking of it. I would always suggest involving people from communities as well in this, because well, everybody knows this. They're a great barometer in terms of what is inclusive and what isn't. And if you start to sort of talk about things that you're not going to bring people on the journey with, then maybe that's something that you need to think about. But yeah, get another pair of hands. If there's anyone that has a equality and diversity job role, maybe, or someone that you know of with expertise, just to have a look at things, that could be useful. But I think it's maybe as well, as even if you're doing things on a very sort of small scale basis, if you can be involving people to then make a case to go to whoever it is that leads the process on all these things, to say, actually, we've done this on virtually no resources. If we did it with a bit more resource, to have a panel, to have a structure, this might yield more results, might yield more. So there is, and use us as well to put that case across. We're more than happy to talk to people who may be a bit sceptical about it and about putting resource in play to say, actually, this does make a difference. So yeah, I just think it's little victories, and little victories are ultimately will potentially more likely to culminate in a big win.
Thanks, Julian. And I feel like that offer is going to lead to a lot of inquiries later on.
I
Um,
hope so. I hope so.
I hope so for you too. We have another question here from Jack. So, if an EqIA reveals that a certain group of people may be impacted either positively or negatively by research, what support are you able to offer teams in contacting and involving those groups who are sometimes seldom heard?
Good question. I think in terms of negative impact is something that people are quite wary of. But sometimes we have to say, as part of the research feedback, that sometimes there is going to be what we call acceptable negative impacts. So if, for example, your focus is on developing an online tool for something, now inevitably there will be people, various disabilities, maybe to do with age, maybe to do with other factors, poverty might be one, for whom an online tool isn't going to work. You know, one of the big things we learned from COVID was that the government presumed that in every household in the country there was a computer that a child coming back from school to work on to do their work. And of course, that isn't. So digital poverty and access to digital resources is a factor. But inevitably, if someone's doing something on an online tool, we're not going to say, well, you can't do that because you're going to be excluding some people. It's not how it works. You know, inevitably as well, we get people that say, yes, we're going to be doing this in certain languages, but we can't do it necessarily in everywhere else. There's 180 languages spoken in Leicester, where I am. You know, if you had 180 different forms of translation and interpretation, your budget's gone straight off. So you've got to be a little bit selective, and equality work is all about things like reasonable. They use these words, don't they? Reasonable and proportionate, and so forth. But I think in terms of engaging with seldom heard communities, one of the things I think we focus on very strongly in Leicester, we've got a big track record of engaging with lots of different people in and outside the Leicester area, is to actually encourage that process of getting out to meet people in communities as part and parcel of your natural work, if you like. We encourage people to attend events that are put on by community representatives, of going to thinking a little bit about where some communities are, for example. So one of the big factors, and certainly in the last 10, 15 years, has been the growth of Eastern European communities, for example, and Romanian is the fastest growing language according to the last census. So there's a considerable Romanian community becoming evident right across the country. So you then begin to think, well, where do I find Romanian people in Leicester? And you have to think a little bit creatively. And one of the factors that we talk to people about is, well, try international food markets, supermarkets. You know, usually there's community notice boards in there. You can go there. You can put a note on the notice board. You can talk to people in the shop. You can talk to. So there's ways of doing it, and I think it's about being creative and being flexible. And recognizing that just because it's worked with one community isn't going to mean it's definitely going to work with others. But don't be afraid to put some limitations, any limitations from your work. You are not going to be able to involve everybody. When I say this to people in the East Midlands, I say the only way you can guarantee that you're going to involve absolutely everybody is including all 20 odd million people that live within the East Midlands. And of course, you can't do that. So you are never going to be totally inclusive. What you're trying to do is eat away at some of those systematic things. And when you find that there are particular communities that are constantly overlooked, being able to actually go in and be a bit creative, working with people that all do have links with those communities, And that might be sports development officers, local government workers, Age UK, for example. You know, lots of great innovative work done by Age UK. Attach yourself with those workers. They're already linked in. Go along, meet people, and from that, you've got to think, right, there's a basis for including people. And I think, generally speaking, from my experience, people that are seldom heard and easy to ignore so welcome that creative impulse, and recognize that when someone turns and says, I just want to talk to you about you, how you live your life. I'm not, you know, it's not about recruiting you for something. It's just, I'm interested. People respond very positively.
Yeah, I know that's great, and it seems to be a recurring theme is that we need to start working together more, and it's a great point to be stressing across.
Absolutely.
So then the next question is, what are the kinds of things an EQA can help you improve or change? And can you give some tangible examples in the research proposal context?
Okay. Certainly one of the bits of research, which actually is one of the template that's on the toolkit page, was from a project called Primrose, that was based in and around the London area. And the researchers there, when they saw the EqIA form, it fundamentally changed their project design. They looked at it and thought, this is asking questions that we'd not really thought of, that we now need to include as part of the whole research. This isn't just a little added extra that has equality over the top of it. This is quite fundamental to the structure of what we do. So they actually changed some aspects of their design as part and parcel of that. We've got evidence of people involving people who had never, they would never have thought of probably to be there, and sometimes I sort of get a bit frustrated when you realise that some health issues are particularly prominent in some communities, and then you see a dearth of people from those communities in the research. You wonder, well, how has that happened? And I think it's because people have not always been pushed to think of how creative they need to be. In the questions that we put in the equality impact assessment, they include, of course, all the protected characteristics. Sometimes people just don't think of it. They don't think, oh, hold on, religion's in there. Is this a factor? I don't really know. What about sexual orientation? That's a protected characteristic. I'm not really sure. Have we ever asked any questions on sexual orientation? Oh, how do we know it's not an issue? You don't know until you ask. So that's encouraged people to sort of say, well, actually, you know, we might need to think about this a little bit more, something a little bit more fundamental. So going to your local LGBT centre and talking to people from trans groups, for example, and so on and so forth. All of those things are key. We have mental health examples, and one of the things that we always focus with mental health is things like, well, you know, have you thought about how to include asylum seekers? I don't know about you, but the work I've done with asylum seekers, the very nature of being an asylum seeker means you've had some mental health challenges in their lives. So, but people don't always think about these things because they've not been prompted to do so, and so that's been a key factor. And the last one I probably would mention is again this dissemination process thing, that people sort of think, right, academic papers have to come as a result of this. And I understand that, yes, academic papers do need to come as a result of research. Of course it does. But they should never be the only consequence and the only outcome from research. How are you going to get people to come back in the future if you don't include people in the dissemination process at the end of your previous research? If you just blank them out by giving them, here's a 50-page report, yeah, you're in there somewhere with all this jargon all right going around it. Yeah. And there's a need for these reports. Don't get me wrong, there is a need for it, but often you going back into the community to talk about the research, I won't say it's all that's needed, but that is a massive thing. You know, it has such an important consequence for people. So in all those factors, we've seen changes, some subtle, some very, very fundamental as well.
Yeah, Thanks, Julian, and thanks, Kerry, for that question. Yeah, absolutely, definitely makes more sense. Like, when you go into the community, you can just get onto a level that you don't necessarily when you're just sending things out and hoping to get something back. When
Absolutely.
you're actually reaching out to groups, it feels a bit more personal. Um, there's another one from Kerry, and I think this might be the last question we have before we finish it up. So can anyone approach you and the team to ask for support with their EqIA, or must you be working with your team or in the general region?
No, anyone can ask for some support. It might differ in depending on what type of support we can give. Obviously, in terms of ARC East Midlands, it's already built into the process of support. But I think the key one is to come on one of our interactive, I don't know what we used to call them drop-in sessions. We now call them interactive seminars, or there's always a word for it. It's just anyone that's got a question or wants to talk about EQIAs can come in. You can sign up, I think, on the ARC East Midlands website. There is a thing that talks about interactive EQIA seminars, monthly drop-ins. Book yourself on that. Come and have a chat with us. It's a very informal process. You'll meet other people that are doing the similar sorts of things as well, and then we can assess. Right, yeah, we can help you with this. It's just a little thing that we can do. Or if it's something more systematic, then there's a support request system as well. So, yeah, you can certainly do it. It's built in if you're in the East Midlands and it's funded by the ARC. If it's not, anyone can come on our seminars. And in fact, we get people from all walks of life, different, not always health as well. It's great. You get people talking about buses and trams and things and babies, and it's brilliant. It's brilliant. We have a great time. So yeah, come and have a chat with us from that.